The old Carolina in the Morning broadcast on Fox Wilmington Thursdays is when we bring in the folks in the white coat. This morning, it's Dr. Brian Lanier. He's with Coastal Family Medicine, and we're speaking this morning about cervical cancer. And Gannon knows by now that while Gannon's in weather, we usually will talk about the topic today. And the best thing you said to me this morning is, down the road, this will be a cancer that we should no longer even have to deal with.
Well, that's the hope. Now that there's a vaccine that prevents the virus that causes cancer, cervical cancer, I think that we hope that there's a day down the road that nobody has cervical cancer. But it's going to depend on enough people getting that vaccine.
And that vaccine, the HPV vaccine?
That's right. So boys and girls can begin to get the HPV vaccine. It's recommended at ages 10 to 11, so around the 5th or 6th grade. And for kids that don't get it at that age, they can get it as teenagers or up until their 20s, depending on male or female. And it's for boys and girls now. And
the 20s is when you were letting me know that that's really when you start to screen women for this a specific type of cancer that you said is very detectable and just the normal screenings that women go through.
That's right, absolutely. Screening begins, the recommendations are for 21 years old, and we screen women up to 65 years old regularly. And there's been some changes in the screening intervals. This used to be simple. Every year women got their pap smear. And there have been some changes in the intervals depending on, that have been brought about by new types of testing and new recommendations that make it a little more confusing for patients and providers. The important thing to remember is, like you said, this is a preventable cancer, and as long as women are in that screening and surveillance pathway, they should have a lot of comfort in knowing that they're doing what they should be doing to prevent cervical cancer.
What are some of the indicators that if a woman maybe for whatever reason isn't going to the doctor as scheduled, that she may notice that maybe I do need to go see a doctor?
Right. So with cervical cancer, a woman wouldn't know that she wouldn't see any outward signs of that until it was in a very late stage. Certainly a woman that has abnormal bleeding that happens between periods, or if they're postmenopausal and they have bleeding, that should absolutely be evaluated by a physician. Any sort of unusual discharge. Those things could be caused by a range of things. Cervical cancer is just one thing, but there's a whole host of things that should be evaluated.
And treatment options if the bad news is that a woman does indeed have cervical cancer. What are the options available for her?
Well, cervical cancer grows slowly. So it depends upon where the cancer is located and how advanced it is. If it's just a few cells, usually it's an office procedure that can take care of that. More extensive cancers need to be taken care of by surgical gynecologists.
But again, the good news here is if you're a woman and you are doing what you're supposed to do, going to a doctor on a regular basis, the odds are this is something you don't even have to worry about.
That's right.
Doctor, I appreciate the
time.
Thanks, Bob. We're back with more after this.